We have someone really cool that we want to introduce you to today for our episode of Driving Cleveland. He has a huge impact on children right here in Cleveland and all over the world. He's the chairman of Cleveland Clinic's Children's Hospital. His name is Dr. Giovanni Piedimonte. So we thought, for an Italian doctor, why not get a hot Italian car? So come along with me. We're going to pick him up in this Maserati. Where were you born and raised?
I was born in Sicily. I grew up in Sicily and then I moved to Rome. So I consider myself Roman, really.
And so you spent most of your younger years in Rome?
Yeah, Rome is my cradle.
And you studied medicine in Rome?
Studied medicine in Rome, yeah. And then I moved.
When did you move to the States?
I was 25 years old.
Was that
very young?
Frightening at the time, or were you ready for that move?
Oh, I was craving that move. I was totally ready. I mean, I love Italy. I'm really Italian. When I moved, I was already grown up in a way, but there were too many things about the medical system in Italy that I could not live with. And so I had this dream of coming to the United States. And so I was totally ready. I was not ready to starve almost to death, like eventually I had to, because I moved. I moved with a scholarship, I think were like $15,000 for a year, and I was living in San Francisco, California.
Oh my goodness.
So
you didn't pick a cheap city.
It was wonderful. I was in perfect shape because I lost so much weight. I didn't have food more than once a day, pretty much.
You didn't have your mother's cooking.
I didn't have my mother's, but I didn't have food, period. It just was worse than that.
Water and
bread. It was worse than that. And the other stupid thing is, since I couldn't afford a car, the only money I had, I could afford a moped. And I thought, San Francisco is in California, so I thought California must be warm. And there are very few cities as cold as San Francisco, particularly in summer. And I froze myself to death.
On a moped.
On a moped.
You've come a long way in a Maserati now, right?
But people say, why do you drive a Maserati? It's because I know what it means to drive a moped.
Well, Dr. Piedimonte, you entered into a form of medicine which I can't think has a better cause than children. Making sure that you take care of the health of children. In fact, I can't think of anybody who wouldn't remember their pediatrician. I know my pediatrician. I stayed with him till I was 18, and finally he said, it's time.
You still are.
See, I knew I liked you the moment I met you. That's the charming side of the Italian men. But I feel that my pediatrician had such an impact on my life. I mean, do you remember your pediatrician?
Oh, absolutely. He was a little crazy, so it's easy. It's very easy to remember. But yeah, I mean, children are to me I decided quite early to dedicate my life to children. I don't think there is any better investment than that. Even now, for example, I feel that I have fulfilled my dreams way beyond what my dreams were. I had a life that I thank God every day. I really cannot complain of anything. The future is not mine. The future is of the children. And if this world that sometimes or all the time seems pretty crazy and there's a lot of bad things in it, if this world is gonna get better, it's probably not gonna be because of my generation, but because of the future generation. So I think that anything has to do with a better world, a better life for this planet, really everything depends on how good is the education that we give to our children, and because what happens 20, 30 years from now depends very little on my generation.
What do you think is the biggest health risk posed to the young generation today, to children?
Oh, without any doubt, obesity is a silent epidemic, and has truly the potential of devastating the very future of this country, and in many ways, because approximately 1/3 of our children have a problem with weight in the United States, which, by the way, people think that is everywhere around the world. But no, is really a problem in the United States.
And why do you think that is? Is it because of sugar?
It's primarily because of the diet. Yes, we do have a problem with little sport activities and physical activities, but that is only a co-factor. The biggest problem, and what makes the difference between the United States and some other countries, is our children are fed with the prepackaged food.
Yes.
I know a lot of children have never seen their mothers cooking, and so this is, I grew up with my mother cooking the food for me. That was the nature of our living, and it was actually a ritual to get together around the table to have dinner.
Right.
And that is gone for many kids, for many families. What they do is basically they either go to fast foods, which provide them with food that is absolutely semi-toxic,
right,
totally toxic, and or prepackaged food that is loaded with carbohydrates, corn syrup, and so forth.
And so what needs to be done about that?
Well, one of the things that needs to be done, in my personal opinion, is to make sure that we actually cook for our children, and we make sure that the food that they receive is balanced, is healthy, and is a diet that is compatible with their growth, and that from the very beginning, because and when I talk about beginning, I'm talking about pregnant mothers. So even before we are born, the diet of our mothers while they're pregnant is a critical determinant of the way we are going to develop our organs. I mean, I've done research on that, and I think I showed pretty clearly that even your lungs, the way your lungs develop, is heavily affected by the mother's diet during pregnancy.
Yes.
So I think we should really concentrate on making sure that pregnant women receive a balanced, healthy diet with the right complement of vitamins, carbohydrates, lipids, proteins, and that is going to be incredibly important. When the baby is born, it's critically important that he's breastfed, because that's one of the best way, to make sure that in that window, the first weeks or months of life, that is essential. I mean,
and that's a sensitive topic for a lot of women too, right?
Yeah,
especially if some have difficulty doing it.
I'm not sure. I'm not sure that it's clear how critical is that window, the first weeks. There are wonderful studies in Europe that indicate that depending on the quality of the diet in the very first weeks, very few months after the baby is born, really can determine a difference in many units of IQ. And if they don't receive the right diet, they don't catch up. So these are not things that can happen just adjusting the diet after. If they are not fed the right diet, if the mother doesn't eat right and the child is not fed the right diet in the very first part of life, and I'm talking literally the first months of life,
yes,
their IQ is going to be different, their potential to develop chronic disease is going to be different, even including cancer, but also their chance of becoming obese is going to be different, and so forth. So one of the things that we should do is to concentrate our resources on the very beginning of life, and particularly the pregnant mother, because a lot of things a lot of pathology for which we spend incredible amount of money, we start spending money when the disease is already there, and it's too late.
You have a focus. You know a lot about respiratory disease, asthma, allergies. Why are we really seeing so many more allergies today? Are we, or are we just talking about it more?
Well, in part, I think we are able to diagnose more accurately to a certain degree. But there is no doubt that independently from that, there is a true increase in, for example, asthma. And that has to have something to do with the environment. Because, yes, there is a very important genetic component in those diseases, like asthma, diabetes, cancer, and so forth. But genes don't change in a few decades. It takes much longer time. And we have experienced enormous increase in asthma, allergies, diabetes, and these kind of diseases over the past 3-4 decades. So cannot be the genes or only the genes. Has to be something that is in the environment. And so something has to do with environmental pollution, with diet. Perhaps there are some infectious diseases that are becoming more frequent, but because there are elements in the environment that make them more likely. And so we have to really look at what happens around the pregnant mother, around the child, at the very early part of life, and what is in the environment that generates this. Now we understand also that our genome, our genes, are not something that is unchangeable. Yes, we get them from mommy and daddy, but the environment is able to modify them. And so that is there is definitely something in the environment of Western industrialized country that without little doubt makes all those diseases more frequent and more and in some cases more severe.
Your work has taken you all over the world. You start in Italy, you've traveled all over the world, you go to San Francisco, you go to Miami, you go to West Virginia, and then you come to Cleveland, Ohio.
Yes.
And so what was it about coming to the Cleveland Clinic where you felt like you could really immerse yourself in all that you were passionate about? What was it about this town that was attractive to you?
Well, my introduction to Cleveland was the Cleveland Clinic. I came to the Cleveland Clinic as a patient.
Really?
I was a patient, and I'm a cancer survivor.
Are you? How many years?
Now 8 years.
8 years.
Yeah, and
That's
when I
wonderful.
had to decide where to get my treatment, I looked at the best, and I came to the clinic, and I thought this is the best hospital I've ever seen, and I was completely remote from me any idea about coming here to work. And then, life is strange. A few years later, they called me and they told me that they were looking for a new leader for the Children's Hospital, and I said, why not? And in a way, when they offered me the job, I said, it's for me, it's for my family, but also I think that this is a place that I owe something back. And I truly believe that Clevelanders should be really proud that the clinic is amazing. You're talking about the many places where I go to give lectures, but it's not only in the United States. I've given lectures pretty much in all 5 continents and something like 150 different countries. And it's unbelievable. The brand of the clinic, when you talk about the Cleveland Clinic, there is not one corner on this planet that people don't know exactly what you're talking about. And there is this relentless pursuit of perfection here that every single one of the folks that work in this organization has a passion to put the patient first and to take the best possible care for their patients. And for Clevelanders, may sound normal, to go through those doors and so forth. This is, without any doubt, one of the best, one of the very, very best hospitals on the planet Earth.